A client visits the health service to have her blood pressure monitored after starting an antihypertensive medication.
Mrs. Erin Rogers, room 2, please. Good morning, please come in.
Hi.
Just take a seat right here. Okay, so my name is Philip, and I will be the nurse in charge of taking your vital signs today at the clinic here today. Could I just confirm your name?
Aaron Roger.
Perfect. So after looking over your medical file, I see that you're here today for a blood pressure follow-up.
Yeah.
And so I'm going to be the one taking your vital signs. Is that okay with you?
Mm-hmm.
The nurse verifies the client's medical file to be able to compare today's reading with past ones. Doing so also enables him to have a better idea of the client's usual blood pressure readings.
So what do you know about your condition?
Well, following my doctor's recommendation, I've started taking a new medication since last week.
And because he diagnosed me with high blood pressure. So today's follow-up is to see if it has decreased.
Okay. So I see that the doctor has prescribed 12.5 milligrams of hydrochlorothiazide once a day. How does that seem to be working for you so far?
Very well. I mean, my headaches are gone and I have more energy since I've started taking the medication. So
Good.
Prior to measuring her blood pressure, it is important to ask questions to the client in order to pinpoint the factors which could cause changes and abnormalities in the patient's vital signs or skew results.
So I'm going to ask you a few questions. First of all, are you experiencing any stress right now?
no stress since I've been diagnosed with high blood pressure. I mean, I know I'm in good hands, so I'm good.
Do you feel any pain anywhere else at the moment? Anywhere?
No pain at all.
Okay. Have you smoked, drank coffee, or had any other beverage or chewed gum within the last 30 minutes?
I had 1 cup of coffee this morning, but other than that, no. I hope it is not a problem.
No, if more than 30 minutes have passed since you drank your last cup of coffee, it shouldn't affect your results.
So good.
A distended bladder can make blood pressure readings vary. 15 millimeters of mercury for the systolic pressure and 10 millimeters of mercury for the diastolic pressure.
Do you need to use the restroom?
I went a few minutes ago, so I'm good.
Perfect. So we're going to begin by taking your temperature. I'm going to ask you to open your mouth. We're going to place the probe underneath your tongue, and it's important for you to close your lips tightly so that there's no air while the temperature is taking a reading.
Okay.
The nurse removes the temperature probe from the module and inserts it into a probe cover. The probe cover protects patients and medical personnel against contact with body liquids and cross- and hospital-acquired infections. Lips tightly closed around the probe keep surrounding air from penetrating into the mouth and skewing results.
Okay, so I see you have a temperature here of 36.8.
The result is displayed on the screen located on the top of the thermometer. The patient's temperature is 37 degrees Celsius, which is normal when using an oral thermometer. Proper disposal of the probe cover eliminates the propagation of pathogenic agents.
So we're going to continue by taking your pulse and blood pressure. So I'm going to ask you to remain silent while we do this. And since you already have a short sleeved shirt, well, we don't need to roll up your sleeve.
Yeah, so that's good.
So I'm going to ask you also, I need you to lean back on the chair, have your legs uncrossed, your feet flat on the ground, and we're going to have your arm bent just like this, your elbow slightly bent, your palm facing upward.
There's so many things to remember.
The nurse also needs to make sure the patient's arm is positioned at heart's height while he is taking her blood pressure. Posture is of the utmost importance. Hence, the nurse needs to make sure the patient's posture is correct throughout the process. Otherwise, the blood pressure could vary and lead to an inaccurate reading.
So first we'll take your pulse.
Using his index and middle fingers, the nurse locates the radial artery situated under the wrist on the same side as the thumb. Then he counts the number of heartbeats over a 15-second period. He then multiplies the result by 4 to obtain the total number of heartbeats per minute. He checks to see if the pulse is regular and strong. A normal pulse rate is 60 to 100 beats per minute. If the pulse is irregular, he will count the heartbeats for a full 60 minutes to make sure the first result is accurate. Once the pulse has been assessed, the next part involves measuring the respiration rate. When doing so, the nurse must first observe inspiration and expiration movements, which entails that he needs to have a clear view of the patient's rib cage. He counts the patient's breaths for 30 seconds and multiplies the result by 2 to obtain the respiration rate for 1 minute. During the assessment, the patient will not be told that her respiration rate is being measured. Doing so could alter the breathing rhythm and skew results. He monitors the rhythm, amplitude, and regularity of the breathing pattern. A normal respiration rate is 12 to 20 breaths per minute. If the rate is irregular, the nurse will need to measure it over a 60-second period.
So your pulse rate is 84 heartbeats per minute, and I see that you're breathing at 12 beats per minute, all of which is perfectly normal.
Good.
So now it's time to measure your blood pressure.
Blood pressure must be measured after a rest period of at least 5 minutes. If the client has done physical exercise, a 30-minute minimum waiting time is mandatory before taking her blood pressure.
So first I'm gonna measure the cuff that I will be using. So I'm just gonna ask you to lift your arm a little bit here.
The nurse chooses the cuff that fits best with the patient's arm. The index markings on the sphygmomanometer's cuff must be located between the two reference lines when the cuff is folded back on the arm. A cuff of the wrong size will skew results. Hence, readings obtained using a cuff which is too large will be lower than the patient's actual blood pressure, and readings obtained with a cuff which is too tight will yield a result that is higher than the real one. The nurse locates the brachial artery. He places the lower end of the cuff 3 centimeters above the elbow bends and at heart level. Once this has been done, he palpates the radial artery with his dominant hand and takes the bulb with his other hand. He places his stethoscope on his ears. He then turns the valve clockwise until it is completely closed. He continues by quickly inflating the cuff to 30 millimeters of mercury higher than the number seen on the gauge when the radial pulse is no longer palpable. He places the diaphragm on the brachial artery. He then gently turns the valve counterclockwise to deflate the cuff by about 2 millimeters of mercury per second. He notes down the systolic level at the first appearance of a sharp tapping pulsation. To end, he gradually continues to deflate the cuff and notes the diastolic level, the point at which the last tapping pulsation is heard. After, he deflates the cuff another 10 millimeters of mercury, and finally lets it deflate completely thereafter. A normal blood pressure is below 120 millimeters of mercury systolic, the first tapping heard, and below 80 millimeters of mercury diastolic, the last tapping heard.
Okay, so I see that your blood pressure today is 120 on 80. Last week we were at 185 on 90.
So that means my new medication is efficient.
Yeah, it is working quite well.
Great.
I'll take this off. Okay. So the last thing that I'm going to do today is we're going to take your oxygen saturation level. There's a light sensor that I'm going to place on your finger that's going to measure the amount of oxygen going through your blood. And don't worry, it won't hurt one bit.
Prior to checking the client's oxygen saturation, the nurse must first determine the ideal site to place the light sensor, more specifically, one with good blood circulation that will give the best results. An opaque surface will reduce the light transmission efficiency, as is the case with patients that have false fingernails. To obtain an accurate measure, the nurse must place the light directly on the patient's fingernail.
Okay, so I see you have a result here of 98%. So I'm going to write that down in your file. So just before we leave, I'm going to schedule your next appointment. we're going to look over factors that influence your blood pressure. So we're going to start by talking about exercising as well as nutrition.
Perfect.
So if I look at my agenda here, how about next Wednesday at 9 o'clock? Is that okay for you?
Yeah, that's good with me.
Perfect. So I'll see you then.
Yeah, thank you.
Thank you very much. It was my pleasure.